Hello Tim, hello Marianne, hope you're keeping well. All hopefully nicely trimmed for you guys and everybody else. So it's just a quick video. We're talking a little bit about 3D in terms of dental implants and how that helps us sort of plan things. So there are two types of scanning when we talk about scanning. One is the CBCT scanning process. So you might hear us talk about that, and that's when we're taking a radiograph, and that type of radiograph X-ray gives us a 3D image of the bone and the teeth and the anatomy. But the focus for this little video is the other type of 3D that we use, which is the intra-oral scanner. And this is like a little camera, and we use that, we go around the teeth and the gums, and it maps out a 3D image. Essentially what it replaces is the putty that we used to use, or the gel that we used to pop over the teeth. It made you feel a little bit uncomfortable sometimes, made you feel like you wanted to retch, a bit of a mouthful, took a while to set. So it wasn't the pleasant of experiences. And what the lab were able to do with that is they were able to pour stone or plaster inside of that, and then that gave them a copy of your teeth, or gave us a copy of your teeth. And then we could use that to plan. Now we've got these intraoral scanners. That's totally changed everything. It's an absolute game changer. This little camera goes around those teeth. It's much less intrusive, much easier to tolerate. It's not that much longer than having what's called an impression taken. And it's instant in terms of how we can send it to the lab. So it goes via an email. The lab then have a 3D image that they can look at through their software, and then we can liaise and we can plan what we're going to do going forward. What we often do is we'll plan where the teeth are going to go if we're using them for implants, so we can actually use this to get an idea of how many teeth are going to be placed, where the teeth are going to be, what's the ideal position. And then we can also use it to make stents or guides, and these are options that help us accurately place the implants. So it's totally changed the sort of level and the quality of implants and how we can place them safely for our patients. I hope that gives you a little bit of information on some of the things that we use and some of the things that we're talking about when we mention scanning, and what we're actually doing when we do that for you. Take care.